Good evening, everyone. Welcome to the webinar on endometriosis. Thank you for taking time to come to this webinar, and hopefully in this webinar, I will be able to talk you through what the implications are with endometriosis. What is endometriosis? What the implications are for fertility and infertility, and of course, what can we do about it? So I'm Professor Ying Cheong, and I'm the Medical Director for Complete Fertility Centre, Southampton. So welcome everybody to our webinar, Endometriosis and its implications for fertility. I'm going to now start the presentation. I know people are still joining. The webinar is recorded, so if you do need and miss some parts of it because you can't join in on time, you can always come to our website and or email us. We'll direct you to the right place for the webinar to catch up on the stuff that you miss. So the first slide shows explanation of what is endometriosis. And endometriosis, generally speaking, is defined as the presence of endometrial-like tissue outside the uterus. Okay, so you can see the uterus is there, the lining of the womb, or the endometrium, as we call it medically. You can see these red lesions here, the example of endometriosis. Yeah, it's can occur in a variable percentage of women, and the reason for the variation in percentage, or what we call the prevalence of the disease, is because many studies they look at the condition in different population, different type of clinics, for example, gynae versus infertility and so on. But if you look at just infertility, patients with infertility, it's about 30 to 50%. So quite significant number of patients that we see do have endometriosis in our fertility clinic. Now, what can endometriosis cause? Well, many women do have pain with endometriosis, often worse during periods, but not necessarily so. And also the curious thing about endometriosis is that actually, many times it doesn't correlate very well with the severity. The pain of symptoms could be very bad and the disease could be very mild, or the opposite, right? Whatever it is, it does and has been shown to reduce quality of life, of course, because of the pain and discomfort, but also it causes a lot of anxiety and depression. What causes endometriosis, you might ask? Well, to be honest, until now, scientists and doctors still don't know completely what causes endometriosis. It's multifactorial, due to numerous reasons, hormones related, of course. There's a theory that menstruation, or the period that comes every month, retrograde, that means it goes backwards into the tummy cavity or the pelvic cavity. So rather than coming out normally, it goes with what we call retrograde menstruation. And of course, there is some genetics association with the condition, so that if there's family history, then there is also an increased chance of getting endometriosis. But there is, however, no gene yet found for endometriosis. So we can't actually say, send you for a gene test and then we will be able to diagnose the condition. We haven't identified such gene, and perhaps there isn't a gene per se, as the condition is caused by many factors. Now, women with endometriosis can, of course, have other conditions with overlapping symptoms. So that means they can suffer from different other conditions in the uterus, such as little polyps or skin tags in the uterus, fibroids, the muscle tissue in the uterus that can cause pain and heavy periods, or a condition called adenomyosis, which is where the endometriosis glands, which is the lining of the womb, has actually, for some reason, embed itself inside the muscle of the uterus rather than just being in the lining. So there is this patient information that is produced by ESHA, the European Society of Human Reproductive Embryology, and it's rather useful. And so I have put a little picture of the leaflet here, so you can refer to it if you wish, and it's freely available on the ESHA website. As you can see here, you can visit the website to get that. All right. And certainly women who may suffer from endometriosis, of course, we try to advise and aim for a healthy lifestyle and diet, reduce alcohol intake, regular physical activity. Although there is no direct evidence of developing endometriosis in the future, so you can't preempt who is going to develop endometriosis, who's not. We don't have the magic formula just yet. All right. The usefulness of hormonal contraceptive. So a lot of patients get put on some hormones when they have symptoms because of pain and so on, but it's certainly not going to be useful. Clearly not when you're trying for a pregnancy, because it will stop you from getting pregnant. So we can't really use hormones when our patients come to us with symptoms. There is also, importantly, no genetic test currently yet available that can diagnose the risk of endometriosis in the future. So we yet do not know who's going to get the disease, who's not. Certainly there are some studies going on to create these testings, but they are not yet available and only available in research setting. What are some of the symptoms if we talk about diagnosing the disease? A lot of patients we see come with infertility, so they've tried for over a year with no success. But of course, some of them also suffer from pain during sex, pain during emptying of bowel, bladder, painful periods. Many of them have cyclical pain, meaning pain that comes monthly. It disappears and it comes back when period starts. And many certainly complain of fatigue. So in terms of endometriosis and infertility, you can see here the three main points. 60 to 70%, or quite a vast majority of women with endometriosis, will have normal fertility. So having endometriosis doesn't automatically make someone infertile. So that's really important to remember. Yeah. Infertility is defined as, of course, not reaching a pregnancy after 1 year of regular trying. And it's certainly generally safe to get pregnant with endometriosis. The complications associated with endometriosis are actually rare, but there are some serious complications that can be associated with endometriosis. How would your doctors diagnose the condition? Well, of course, when you go to see your doctor, we would of course take a medical history, examine you. But some of these radiological investigations will be important. So what do I mean by radiological investigation? Here you can see ultrasound scan or CT sometimes. We even send patients for MRI if the condition is quite complex. We can also, of course, do a keyhole operation and put a tiny little camera into your pelvis when you are under general anesthetics. And the keyhole procedure will facilitate us looking with our eyes directly at the lesion if there were disease there. At the same time, we can treat the condition. At the same time, also, we can check if the fallopian tubes and everything is open with what we call a dye test. All right. Now, this is a little bit medical, but this is how your doctors, or rather specialists, stage the endometriosis. Okay, there are different stages of endometriosis, from the least with a few spots only to quite severe disease with a lot of scarring, and involving a lot of the tissue around in the pelvis, like the uterus, like the bowel, like the bladder. So that's quite a serious one. And then, of course, there's in-between conditions where maybe you get a little bit of endometriosis on your ovaries, a little bit on the bladder, and so on and so forth. So these are stages of endometriosis which your doctor, consultant specialist, we will be assessing if we were to do a keyhole operation to check the pelvis. What are the treatments if you do suffer from endometriosis? What can we do? Of course, there are various different options depending, of course, on what you go to your doctor with, a predominant problem that you're complaining, right? Is it pain? Is it fertility? And so on, right? So you need to have a really good discussion with your specialist about this. Now, not all patients need surgery, but some of them, as I explained to you earlier, need a keyhole operation to look inside the belly, inside the pelvis to see if the disease is there, and then we can, of course, remove the disease, all right? Now, some patients may choose to have what we call medically assisted reproduction, or IVF, and also some may choose to have IUI, intrauterine insemination, and I shall explain what these are in a minute. Now, if you came with an endometriosis diagnosis, of course, or if you suspect you have the symptoms, you might want to get referred. Either you can come to our center, NHS or private, self-referral. Our consultants will look at your condition and, of course, take a detailed history, as I explained earlier, and then, of course, investigate with the right investigations to check, and then, of course, whether you then need medical surgical optimization before fertility treatment, or some patients go straight to fertility treatment. It all depends on the individual situation, okay? And what happens if you do undertake fertility treatment? Well, this is an example of a timeline of a fertility treatment that you undergo and what it is in terms of time frame. So you take some hormones, yeah? And if you are going for insemination, of course, we will put the sperm, I can see here a little sperm, into the uterus at the right time. Right, that's called intrauterine insemination or donor insemination, depending on what sort of insemination you need. But of course, you can also go for IVF ICSI, which is basically in vitro fertilization, or intracytoplasmic sperm injection. A bit of a mouthful, but essentially is a process where we can retrieve eggs out of your body through a very small surgical procedure and fertilize the egg outside your body, forming what you call an embryo here, which is a very early pregnancy, not yet implanted. We can then pop the embryo back into your womb, and hopefully a couple of weeks later, we have a pregnancy test positive, and here your pregnancy scan, okay? And the question a lot of patients are curious about is what happens in the IVF lab. You're going to IVF. And you know, the embryologists look after your eggs, sperm, and embryos whilst they're outside your body in the laboratory very carefully. They observe it, you know, all the time. We now also have very, very advanced equipment in the laboratory to look at the videos of how these embryos will develop, and I will show you some of them in a minute. There we are. That's the Embryoscope that we have, which is the incubator with built-in camera. It's very, very clever. It takes the images, and then we can actually look at the images and scroll it to and backwards to examine the growth and the development, and then, of course, help choose the best embryo to put back into your womb. The system also for assessing the patient ID is very, very important, because that's a quality control to avoid incidents of mismatch. This never happens anymore because we have an advanced RI witnessing system in our laboratory. Egg collection, as I described earlier, is a small surgical procedure which is ultrasound guided. So we put the needle through the vagina, so no cuts on your tummy as such, and egg comes out and it goes into the tube that goes straight in the laboratory to get looked after in the incubator in the time lapse, as I explained earlier. These are some pictures of eggs, sperm. The sperm is not usually lit up. This is just an illustration, and you can see here the egg and the sperm, intermingling, and at some point, one sperm will gain entry, and that's called IVF insemination. And this is a video of what we call intracytoplasmic sperm injection. And what is going to happen is you see the little sperm coming in, tip of the needle. Needle is very, very small, and the embryologist very cleverly position the needle at the right place in order to inject the sperm into the egg, as you can see there. And when the sperm is placed into the egg at the right position, then as fertilization will be encouraged to occur. You can see this is very skillfully done here. Okay, and in the laboratory, then you can see we will be able to look very intensely at how the embryos grow, and you can see here day 1, day 3, day 5. Day 5 embryos are called blastocyst stage, and then actually on day 6 they will hatch out. All right, and this is a video of one of the time-lapse embryo development that you can observe here. It is certainly something we look at day in, day out in our laboratory, and our embryologists will really carefully also document all this, and then be able to choose for you the best embryo to put back into your uterus at the embryo transfer stage. And you can see here how impressively this embryo is developing itself, and then it started with only a few cells, and then suddenly at day 5 it's reached a few hundred cells, and that's a blastocyst, a beautiful blastocyst. Okay, the embryo transfer. Oh, what happened there? Sorry about that. Embryo transfer is a procedure. Oh, it doesn't allow me to do. Apologies for that, but the embryo transfer, we just put a little catheter in, and we'll be able to, hopefully allow the embryo to implant into the uterus. Tiny little catheter, very, very non-invasive procedure, like a smear test. Okay, and of course, apologies, the slide keeps wanting to skip itself, but the next slide from there was about the frozen embryos. Of course, you might have more embryos to store, and we won't throw it away, of course. So any spare embryos will be frozen, and then they could be used in a subsequent cycle. Okay. Now, we also offer, of course, included in the treatment package, a counseling service, and there's certainly a huge amount of benefit for patients to undertake counseling service, because treatment can be stressful, and so our counselor can offer that support for you. And there's, of course, various different support groups, infertility ones, but also there are other support groups specific for endometriosis, as you can see there, either through the European Society or through endometriosisuk.org. And there are several other, depending on your location, local support groups as well, which you'll be able to locate through Google. But here are some of the examples of support group that you can get for endometriosis. In complete fertility, we also provide a mood monitoring support, mood management support. This is evidence-based. personalized support via a phone app called MediEmo. And certainly our data research has shown that it does benefit our patients hugely. A load of questions usually around NHS eligibility for IVF, and these are some, but they are quite specific to the postcode, and so every patient, when they come through, if they're asking around NHS eligibility, we would need to look at the location and look at the individual criteria for the commissioners carefully, because there are variations in the criteria, and here are some examples. The Fertility Centre, we also offer some fertility programs fund to help funding, and so if you do want to know something around finance, this will be one of the programs is Access Fertility, but our finance department will be able to help guide you on some of these programs that are available to assist you financially. And so these are some of the pictures of our center at the moment here in Southampton. Of course, if you have any further questions, please do email us or give us a call so we can help you with your questions and see if we can set up something for you in terms of treatment. So the phone number is there and the email is there. I apologize if you can hear some helicopter noise. It's the air ambulance taking off or landing, either or. Seems a busy night tonight. Okay, so that's the end of my presentation, and I would be happy to take questions if you have any. So if you need to ask questions, I can take your questions in the chat box, or in fact, if you have any questions or Q&A questions. If not, then of course, if you miss any of my talk, that is recorded, so you could take you could look at a video at a later stage. Yeah. I don't currently see many questions here. Let me see if there's any questions. I don't see any questions here. So there is a question around same-sex couple being able to access the Access Fertility. I'm pretty sure you can, and I think it really depends. I think Access Fertility will assess individual circumstances in terms of their medical history. The different programs. So some will need your medical history so that they can assess if you be funded, and others do not require that. So I think if you want to access that finance, then please email us and let us know, and then we can see how we can assist you, knowing your personal individual circumstances. Yeah. And is there any other questions we've got there? Not at the moment. There are some questions that are very commonly asked, like what sort of diet should I take, different types of pills and so on. As I said in the presentation, there aren't a super diet for endometriosis, or in fact, indeed, any fertility. Of course, if you're trying to conceive, we advise you to have vitamin D and folic acid. A lot of patients would go and take something like a pregnancy supplement, and that's totally fine. And of course, if you are able to eat a balanced diet, that would be really great. But it's absolutely not necessary to be, supplementing yourself with everything, that you can see from a fertility shelf in the supermarket. What's most important is to keep a healthy, balanced diet with folic acid and vitamin D supplementation, which usually is contained in a pregnancy supplement that you can get normally from the supermarket. Yeah, so that's a very common question that we get asked. Some other questions are around, acupuncture. Should we have acupuncture? Would it help with endometriosis? Would it help with fertility? Again, that's a very individual question. There are some individual sort of circumstances. There are some guidance in HF on the HFEA website, but it's very general. And I think the important thing is to make sure that you are comfortable with actually having acupuncture or any complementary medicine treatment, and whether you feel relaxed about it. And if you do and you find that you can have a reasonable period of time of relaxation during the treatment, then yes, of course, there's nothing to stop you from having a treatment. The evidence currently is not conclusive. It doesn't say one way or the other. So, and there's certainly the studies have all stacked up to say, well, there seemed to be no harm in the live birth rate, neither is there a huge benefit in terms of live birth rate. But so I think the circumstance, if you are accessing things like complementary treatment, then the best thing to do is actually to judge it individually and see how comfortable you are with those treatments. Okay, so I don't see any further questions there. Okay, so there is a question just pop up. Is IVF more likely to be used than IUI with endometriosis? Not necessarily. In my experience, a lot of patients with severe endometriosis, they certainly require IVF because, endometriosis can cause scar tissue. As I showed you the staging. If the scarring is quite severe, then the problem is it will damage the fallopian tube. If it damages the fallopian tube, that means the eggs cannot travel smoothly into the fallopian tube to meet the sperm. And if that's the case, then of course IVF would be needed, because we can't, in IUI, the fallopian tube is relied on to transport the sperm and the egg to meet in the tube, right? But if the disease is mild and the fallopian tubes are open, IUI can benefit some patients as well. So I think the question of IUI or IVF is really dependent on your personal circumstances, and that's your consultant. We would obviously be looking at your history carefully and see whether you'd be able to benefit more from IVF or more from IUI, or one or the other is actually suitable for you. So it really depends on individual. So it's not a no for either. It really depends on the individual condition. Yeah. So that's a very good question there about the different types of treatment. I think we're running low on questions now, and if there are no further questions, as I say, the video is recorded, so we'll be able to, you can be able to look at it at a different time if you want. But otherwise, I would I would conclude the webinar, and hopefully you enjoy the talk. Yeah. So welcome. So thank you all for coming to the webinar, and we'll see you soon in our future webinar on general fertility. Take care now. Bye bye.